Hi, I'm Linda Miles of Virginia Beach, Virginia, and I'd like to talk today about something that is part of a seminar I did 10 years ago called Women Working with Women, From Sabotage to Support. It's one of the biggest issues in dentistry, and that is it can be different groups of people. We'll talk about the long-term team member versus the newest hire. So many times you see long-term people who are enthusiastic, who love to go to continuing ed, who love to make changes, who love to embrace and bring the new people in. But occasionally, as consultants, we run across the long-term employee who says, they've got too many new ideas, we liked it the way it used to be, we're not going to listen to them, we're not going to encourage them, we don't like their enthusiasm, and they're really the inner circle. And so the inner circle can be a group of different parts of the team. In some practices we go into, the inner circle is the long-term staff, and the new people are walking around the outside called the outer circle, just trying to get in and be part of the team. But the inner circle doesn't like that, doesn't want their input. Then we go into the next office and we see an entirely different inner-outer circle. In the next practice, we may find clinical team members as the inner circle and the administrative team sort of running the outside circle, and the clinical team are saying things like, I wish they'd learn how to schedule. I wish they would know how to handle a late patient. They're working us to death. All they do is sit on the chair and roll around on the chair talking on the phone. They have the easiest job in the practice, and we're back here working ourselves to death because we have to see all these people, and woe is me. So that's the inner circle called the clinical team. In the next practice, it might be the administrative team who have been there short or long term, who think they're running the practice and they get to tell the clinical team what to do. So this inner and outer circle can be very devastating to the dentist owner. It can be very devastating to the bottom line. And if you think patients don't pick up on this, they certainly do. And the worst inner circle of all, and I've seen it in a few offices, is when the entire team is the inner circle and it's the poor doctor or the doctor's spouse in some cases as the outer circle. The doctor walks into the staff lounge, the talking stops. Guess why? They're talking about the boss, and it usually isn't favorable. What is the greatest marketing tool in the whole world? It's a team that believes in their doctor, they believe in their doctor's dentistry, they believe in their doctor's fees, they promote the practice in and out of the office, and they're a great team member, and there are no prima donnas, queen bees, they're all fabulous team members, and that's what sets a really great practice apart from the ones who have drama. In order to get in touch with Linda Miles, I have a new website called AskLindaMiles.com, and I am available for half-hour, full hour, or 3-hour blocks of time to talk to dentists, to dental spouses, to dental team members, to other speakers and consultants. And it's one of the fun things that I do about 6 hours a week. So if you'd like to get in touch with me, my number is 757-721-3125, or my email is lindamiles@cox.net.